I'm going to jump into the fray on this whole lower stomach technique. Personally, I find this to be flawed, but it's just making me feel like I don't know my anatomy, less so than it is making me feel like I don't know what I'm doing. This is a female pelvis, and we're going to talk about content that is for maybe a mature audience, so just be prepared. This is the uterus, that's the bladder. These two nerves are what I want to bring your attention to. That is the labial nerves, the ilioinguinal nerve, and lower there, the femoral nerve. Okay, so those two nerves provide innervation to a rather important structure, or the lips around the opening of this structure, the labia majora. So whenever we talk about pressing down on the lower stomach, it's less actual stomach because that's going to push down on the bladder, which can stimulate the vaginal canal down there. You might hit a certain spot a little more, but you may also introduce yourself or get taken to Tinkletown instead of seeing the O-face. I would say more here and more of a resting pressure because it's going to have novel stimulation where you don't usually get any. So instead of, focusing on the main event, you're going to be up here focused on these sensory nerves and their paths kind of up through the hip. All right, boys and girls, that's just my interpretation here. Feel free to tell me I'm wrong, but I feel like this might be helpful.